My name is Brad Holland. I'm the CEO of Hendrick Health System, and today we're all experiencing new ways of communicating. And this new virtual way of communicating is something that we're working towards visiting with our employees on a daily basis through virtual town hall meetings. But in light of today's environment, it's hard to do community visits, and there's so much happening here at the hospital. We thought we'd try this way as a way to communicate to the community. Today, COVID-19 is an all-encompassing activity here at Hendrick, but I'm really couldn't be more pleased with the way that our employees have risen to the occasion, led by our Board of Trustees and administrative team and great leadership here at the hospital. With over 3,600 employees at Hendrick Health System, they really are the heart and soul of the organization. And in this unprecedented time, there is no question about it, our volume has been impacted. With over 50% reduction in volume, we are not immune to the ramifications that we're seeing across the economy. It has impacted people. It has impacted people's lives, and including their paychecks. One of the things I'm most proud of at Hendrick is the fact that our Board of Trustees and administration have made the commitment not to lay employees off, not to furlough employees, and mitigate any reduction in pay where possible. We have been embraced by the community through all of the mitigation and social distancing efforts that we've seen in Abilene and the greater Texas area. What we've learned through this pandemic is that Abilene is not New York. We have learned that we had a little bit of heads up, and we started social distancing and mitigating at a very early time. And that has been very successful for our community. We have definitely, quote, flattened the curve. And that has been very beneficial to the healthcare providers here in Abilene and the big country. But what we also know is we're also getting a little bit, there's a lot of unrest out there. And one of the favorite quotes is that the cure can't be worse than the disease. And as a CEO of a hospital, I too am supportive of opening up the economy. But we have to do it in a smart way, in a way that we recognize COVID curve here in Texas and in Abilene is we're on the front end of the curve, of the peak. We hear this word peak all the time, but we don't know when we're going to, quote, peak here in Abilene, Texas. I don't think it's going to be a peak or a spike. I think it's going to be an elongated curve. And so what we have to do is find ways to mitigate that curve and live with COVID. And I think that's what we're focusing on here as a hospital provider, and want to update you on things that we're doing here at Hendrick, both in the short term as well as the long term. We have been very successful in growing our lab products. You hear that the 3 ways to beat COVID-19 are testing, testing, and testing. And I'm very proud of our lab team. We started our own in-house testing, and today we're testing up to 240 patients a week, and we can still supplement that with third-party labs. What I'm seeing is that the future at Hendrick looks very strong. We're in control of our testing. We're in control of our own flywheel or continuum of care. We have the PPE to take care of you. But we are not immune from the concern by any means. Prior to COVID-19 hitting, Hendrick Health System has been looking for ways to expand access or expand capacity. We have been near being full for years. And as a CEO of the hospital, I've been looking for ways to expand this organization prior to COVID-19. It has become even more so relevant today than it ever has in the future. What we have seen is through this pandemic that there is incredible economies by working together with the city. We've been working with Abilene Regional Medical Center and taking a citywide solution on bed access, ICU beds, nurse pools, overflow solutions. And it has given me great perspective that working together, we are stronger than we are apart. And it just has reinforced my belief that integrated care is the solution to making Hendrick more efficient, safe, and more cost-effective in the future. And so I'm going to continue to look for opportunities to grow the Hendrick system and expand the Hendrick mission. One of the things that we tell people during this pandemic time is you stay home and we'll continue to work for you here at Hendrick. You can help us by continuing to practice hygiene, social distancing, but also mask wearing. We believe that two people wearing masks significantly reduces the exposure probability of both people. But wearing masks isn't because you're keeping yourself safe. It really is a courtesy to keep the person next to you safe. They say that asymptomatic carriers may be all around us. And if you don't have the luxury of being tested yet, like most of us, wear a mask. And that not only protects you, but more importantly, it protects the people around you and also your loved ones. And last of all, something that I've worked very hard on personally is avoid touching your face. Because you don't know that last doorknob that you may have touched. And wash your hands routinely, and if you can, find some hand sanitizer and use it routinely. What we are seeing is a drop in flu, and we believe that because people are washing their hands more often. We do know that COVID-19 is highly contagious, and I do believe it will live with us for a while. We've identified that our peak or plateau or a period isn't going to be until June. Now, a model is only as good as the information as you put in it. However, that is what our model shows. Not that COVID-19 goes away in June, but that's when we're going to start to see a decrease. Today is April 21st. We only have 164 cases in Taylor County. That's less than 1% of the population. For a disease that we know is highly contagious, it will continue to spread across the population. And I can only hope that social mitigation keeps you and your family safe. But we do and are preparing to live with COVID-19 for quite some time. I encourage you to work with the city on what you can do to open your business and get back to work, but also continue to be cautious and mitigate where you can. And I encourage you to reach out to me, Brad Holland, if there's anything I can do or provide any guidance to you, your loved ones. And it's been an honor to serve you here at Hendrick Health System. Thank you.